everyone, my name is Sing Kim, and today I'm presenting a patient safety plans of action for a brain MRI with and without contrast. So the project purpose is to ensure patient safety, diagnostic quality, and to help reduce anxiety for the patient. And we want to also identify any hazardous metallic materials. So for the patient overview, our patient's name is Mrs. Jane Doe. She's a 30 years old female and she's currently pregnant, and she's going to be having a brain with or without contrast. And to be performed, we're going to be using a 1.5 Tesla magnet. And the reason for exam is because patient complains of persistent headaches. And our goal for today as an MRI tech is to demonstrate a through screening process to ensure the patient's safety and diagnostic quality. So here we can see the original screening form completed by Ms. Jane Doe. So during the initial review, we can see that she's currently pregnant and she's currently taking prenatal vitamins and has several metabolic and physiological factors that requires her attention as an MRI tech before she enters the magnet room. So such as, for example, like tattoos or permanent makeup and body piercing jewelry. So upon reviewing the form that the patient have complete, uh, we can identify four primary obstacle. The first one is body piercing, and which pose a projectile and heating risk. And the second one is tattoo, which can cause RF heating or skin irritation. And the third is pregnancy, as indicated by her use of prenatal vitamins. And the fourth is the contrast administration. Since the order is for a with and without contrast exam, her pregnancy status significantly impact our ability to process. So based on these findings, the patient status is MRI conditional. This means that the scan can only proceed only if specific safety parameters are met. So my research on MRIsafety.com confirms that tattoos, particularly with those with iron oxide pigments, they require monitoring for thermal injury. So furthermore, all body jewelry must be removed or verified as non-ferrous to prevent movement or burns. So to ensure Miss Jane's safety, um, as an MRI tech, I will implement several special consideration. First, all body jewelry must be removed before she enters zone 4. And second, I will use cold compress or surgical tape over her tattoo if they are located within the RF field of the head cowl. And thirdly, I will remain constant verbal contact and provide her with an emergency squeeze bulb, instructing her to alert me immediately if she feels any warmth or tingling. And for the pregnancy, I think it's important for the MRI tech to outweigh the benefit of MRI over the risk, and also requires specific documentation and discussion with the patient regarding the use of the 1.5 Tesla magnet. And for the piercing, I would ask the patient to remove all body piercing jewelry and to prevent injury or image artifacts. So for the contrast media criteria, the most critical obstacle is the contrast media. So does the patient meet the criteria? Potentially no, and she requires cautions because Miss Jane, even though Miss Jane has no known allergy or kidney issue, she's pregnant. So current ACR guidelines state that gadolinium should only be used during pregnancy when there is an overwhelming clinical need, that cannot wait until after delivery, because the gadolinium molecule can cross the placenta. So we must be really, really and extremely be cautious using it with the pregnant woman. So, does this case require radiologist approval? Yes, absolutely. The radiologist must perform a risk-benefit analysis regarding the pregnancy and the necessity of contrast for headache diagnosis. So, as shown in these reference image, our primary concerns are avoiding thermal burns at tattoo sites and ensuring the safety of the fetus. And once the radiologist provide a written order to proceed, we will follow all conditional safety protocols. And in conclusion, by identifying these obstacles early and consulting the proper safety resources like mrisafety.com, we can prevent patient injury and ensure successful diagnostic study. So here's my references that I use for the safety plans. Thank you guys.